This is a video on pelvic floor muscle training for providers. Let us review the pelvic floor muscle anatomy. The pelvic floor muscles are attached anteriorly at the inferior pubic rami and wrap in a U-shaped configuration around the genital hiatus, encircling the urinary outlet, vagina, and rectum. The pubococcygeus and iliococcygeus muscles make up the levator ani complex and can be palpated on digital pelvic exam. This anterior view from medial to lateral shows the puborectalis, the pubococcygeus, and the iliococcygeus muscles. Perform a baseline assessment of pelvic floor muscle strength. With a patient in lithotomy position, place your middle and index finger together into the vagina, palm down. Allow your fingers to rest gently against the posterior vagina, and ask the patient to perform a Kegel by squeezing her pelvic floor muscles. Document her baseline Oxford score. 0. No contraction. 1. Flicker of non-sustained contraction. 2. Weak but sustained contraction. 3. Moderate contraction which compresses your fingers. 4. Satisfactory contraction compressing your fingers with some vaginal elevation. 5. Strong contraction with firm compression of the fingers and definite vaginal elevation. Make note of inappropriate contractions being performed. Common but incorrect maneuvers include gluteal lifting, abdominal straining, and hip adduction. Now that you have done a baseline assessment, you will begin your teaching of pelvic floor strengthening. Have your chaperone start the timer. Isolating the pelvic floor muscles requires active relaxation of all other muscle groups. You can help your patient focus on this by directing her to relax in areas of her body: her chest, her arms, her abdomen, her bottom, and her legs. You may now instruct the patient, with all other muscle groups as relaxed as possible, squeeze where you feel my fingers with your vaginal and rectal muscles. Pay close attention to any change in pelvic floor muscle tone. Document guided pelvic floor muscle contraction number 1. 0 for none, 1 for flicker, 2 for weak, 3 for moderate, 4 for satisfactory, 5 for strong. Provide biofeedback to your patient. Ma'am, I notice that you are still contracting in your abdomen and lifting with your legs and with your bottom. Please relax in those areas of your body and squeeze where you feel my fingers with your vaginal and rectal muscles. Feel for contractions of the pelvic floor. When correcting patients during biofeedback, verbal cues can be very important. Useful cues are: tighten as if you want to hold in gas, or imagine a small ball on a chair and squeeze as if you will pick it up with your vagina. Palpate for pelvic floor contraction. Document Oxford score number 2. By this point, you may likely notice an improvement in your patient's ability to correctly isolate and contract her pelvic floor. Provide feedback. That was much, much better. Now, let's please once again contract your vaginal and rectal muscles around where you feel my fingers. Note changes in pelvic floor contraction and document Oxford score number 3. Provide some final feedback to your patient. Excellent job. That is how you correctly contract your muscles. Great job. Stop the timer. You may now provide additional recommendations to the patient with handouts and/or verbal instructions for home practice. After continuous practice of this skill in an outpatient setting, you should be able to assess baseline pelvic floor muscle strength, identify incorrectly performed exercises, teach pelvic floor muscle isolation, confidently use the Oxford scale, provide biofeedback, and see a clinical improvement in your patients. This completes a video for pelvic floor muscle training for providers.